Did you know that women are more vulnerable to certain lung diseases than men? While both men and women face serious respiratory health challenges, research has shown that women are more susceptible to certain types of lung diseases, and the reasons may surprise you. In this video, we'll explain why women are at greater risk and what you can do to protect your lungs. 1. Hormonal differences in lung health. One major reason women are more vulnerable to lung disease is hormonal differences. Estrogen and progesterone, the primary female hormones, play an important role in lung function. Estrogen, in particular, has been linked to inflammation and airway constriction, which can increase the risk of asthma and other respiratory conditions. During menopause, when estrogen levels drop, lung function can naturally decline. This makes postmenopausal women more susceptible to conditions like chronic obstructive pulmonary disease, COPD. Hormonal fluctuations, especially during pregnancy or menstruation, can also affect lung function. 2. Smaller lung size and higher sensitivity. Another factor is the difference in lung size. Women generally have smaller lungs than men, which means that their lung capacity is lower. This puts women at a disadvantage when it comes to dealing with respiratory infections or diseases. Additionally, women's lungs may be more sensitive to environmental pollutants and irritants. Studies show that women tend to experience stronger responses to air pollution, cigarette smoke, and chemical exposure, which can trigger conditions like asthma, bronchitis, and even lung cancer. 3. Smoking. A greater risk for women. While smoking is a known risk factor for lung disease in both men and women, women who smoke may face a higher risk. Research shows that women are more likely to develop lung cancer, even with a lower level of smoking compared to men. They also tend to experience more severe symptoms of COPD at an earlier stage. One reason for this is that women's lungs are more susceptible to the toxic effects of smoking. Smoking also exacerbates hormonal imbalances, leading to further damage. This means that even if a woman doesn't smoke as heavily as a man, the damage to her lungs can be more significant. 4. Increased susceptibility to respiratory infections. Women are also more likely to develop respiratory infections. Conditions like pneumonia, bronchitis, and the flu can cause serious lung damage, and women tend to experience more severe complications. This is particularly true for pregnant women, as their immune systems are more vulnerable during pregnancy. Furthermore, certain autoimmune conditions, which are more common in women, like lupus or rheumatoid arthritis, can also affect the lungs and make women more prone to lung disease. 5. The silent epidemic. Gender bias in lung disease diagnosis. One overlooked factor is the gender bias in diagnosing lung disease. Women's symptoms may not always match the typical textbook symptoms of lung conditions, which tend to be based on male patients. This means that women often receive delayed or misdiagnosed treatment, leading to worse health outcomes. For example, women with COPD may experience more fatigue and shortness of breath than men, but doctors may not recognize these symptoms as indicators of the disease. Early diagnosis is crucial for better treatment, and doctors need to be aware of the unique ways lung disease presents in women. 6. How to protect your lungs as a woman. So, how can women protect their lungs from disease? Here are some key steps to keep in mind. 1. Quit smoking. If you smoke, quitting is the single most important step you can take to protect your lungs. 2. Exercise regularly. Physical activity strengthens your lungs and improves lung capacity. 3. Limit exposure to pollutants. Stay away from secondhand smoke, avoid heavily polluted areas, and use air purifiers indoors.